My name is Chris Murphy, Director of Marketing and Product Management with Alliance Payroll Services. I want to thank all of our clients and invited guests for taking time out of their busy schedule to attend this event. This is the second in a series of Affordable Care Act regulation update webinars that Alliance Payroll Services is going to be sponsoring. All of these sessions are designed to help you and your business stay informed of the ACA regulation and any updates that impact ACA and your business. So we'd like to remind you to be sure to check your email inbox and the homepage of the Alliance Payroll website for future session information. So our Affordable Care Act expert for today's session is Attorney Andy Impastato. Andy is Vice President of Client Compliance at BancorpSouth Insurance Services. In his current position, Andy is responsible for providing regulatory guidance on new legislation, HR management, and benefits administration. Prior to joining BancorpSouth Insurance Services, Andy was the manager of legal operations at Blue Cross Blue Shield of Mississippi. Today, Mr. Impastato is a member of the American Bar Association and has been practicing law for over 9 years with a history of providing legal and compliance advice on employee benefit matters, including all aspects of health and welfare plan administration. Andy, I'm going to turn everything over to you, and we do look forward to your presentation today.
Thanks, Chris. It's my pleasure to be with all of you this afternoon. Hope I won't get too much in the way of your weekend. This is an important topic. It's not sometimes an unpopular topic, but it's an ever important topic for all employers. Chris had mentioned the acronym ACA. That stands for the Affordable Care Act, as many of you know. As far as a big deal, it's probably the biggest deal we've seen in the employee benefits world since ERISA was passed in 1974. And make no mistake, it will have an impact on every employer regardless of size. So let's jump in. I've got a lot to cover. And like I said, I'm going to move pretty fast. I told Chris it's just for the sake of time, I do want to make sure we cover everything. So let's take a look at what we're going to go through. Just a little bit on political outlook, because we do see a lot of this and field a lot of questions on this. I want to look back a little bit, if you bear with me, and go over some existing requirements. As you know, the law is nothing new. It was passed in 2010, but it's received this sense of urgency and this sense of permanency lately due to several factors, and we'll talk about some of them. The bulk of the presentation is really going to be on future requirements. That's kind of our in-depth dive, if you will, and then hopefully give you guys some practical but useful guidance at the end. And as Chris mentioned, we'll take as many questions as we can at the end, but be not afraid. Any questions that we submit, we will answer them and share them with everyone next week. So, you know, everybody knew about the Supreme Court decision. Everyone knew what happened in the November elections. I'm not going to talk about those today. But I do want to just touch on the ramifications a little bit. I say status quo because we know how the Senate and the House have fallen, and we know that President Obama was reelected. So, you know, what we're getting at is the Affordable Care Act is a federal law. It should be treated with importance just like any other law, despite your personal feelings towards it. I think the elections did have kind of a ripple effect on two concepts. One is this concept of an exchange. As you know, the way the law was written, states had the right to elect whether they wanted to establish and run an exchange, and if they didn't, the federal government was going to come in and run one for them. I think this has kind of been a big blow for the administration, in my opinion. I think right now you've got out of our 50 states, 36 have defaulted to the federal government. So I don't think the administration was anticipating carrying the load, so to speak, on that many states. So I really do think they're kind of up against the 8 ball. I go to D.C. a good bit for work, and I was there not too long ago, and the question came up about whether the administration was going to have the manpower and the capability to get the exchanges up and running in 1/1/14. And I was told in no uncertain terms by the highest people in administration that will happen. So what I think is going to really play out, though, is you know, you'll have the Rose Garden speech, and everyone will say that the deadline was met. But when you really start to look at the exchanges, they're really going to be bare bone at first. We're monitoring, our company, BancorpSouth, is in 8 states, and we're monitoring carrier participation in those states. And right now it's really slim. For example, I live in Mississippi, and we only know of one carrier today that's going to participate in the exchange at first. And similar states are kind of taking that same route. So as far as being a vehicle to serve as a comparison tool, I don't really know how much bang you're going to get for your buck on the exchange. The other concept is this notion of Medicaid expansion. Really, the intent of the law, it's got the word affordable in it, but it's really not going to be affordable for employers, and I'm sure all of y'all are well aware of that now. The way the law was written, all states were going to forced to expand Medicaid, and if they didn't, they were going to risk losing federal funding. If you remember, this is the one thing that the Supreme Court shot down. They basically said you can't hold states hostage. They have a right to elect whether they want to expand or not. So you're kind of seeing this fall in place as well. A lot of what we would call red states, a lot of southeastern states, either for budgetary reasons or for what I would call ideological reasons, are refusing to expand Medicaid. And so, this notion of every American being able to be secure coverage in some sort of fashion, I think this is another blow, in my opinion, to the administration. They were hopeful to get 40 million Americans on, and we're not going to be anywhere near that number based on what the states have indicated so far. I've got a little bit here about litigation. I say that because there are some interesting cases that are pending right now, and I think you're really going to see a lot of an increase in litigation in the future because it's really the only method of attack, so to speak, for opponents to challenge the law and try to defeat it. So we may talk a little bit about some of the cases as we go through if time permits. Okay, let's talk, like I said, a little bit about existing requirements. The reason I want to do this is a lot of employers, I speak all the time and we travel all the time and speak to employers. And in October, everybody wanted to talk about the chances of repeal and things like that. It was pre-election time, and now we kind of know how the dust has settled. But a lot of employers took this wait-and-see approach. And what I mean by that is, they were hopeful that the Supreme Court would overrule it. It didn't. Then they were hopeful that the elections may come down a certain way, and they didn't. And so people that have really kind of, not paid attention to the law or not taken steps to make sure they're in compliance with the law really have some work to do. It really wouldn't matter to me personally, but unfortunately part of healthcare reform provided additional funding to the Department of Labor, and they've hired 4,000 additional investigators that are out on the streets today auditing group health plans. And obviously they're always looking for all the existing federal laws that we've always had to deal with, like HIPAA and COBRA and ERISA, things like that. But what they're also looking for are existing Affordable Care Act requirements. And one of the big issues that we're seeing right now are with grandfather plans. For those of you, grandfathered, I think, really started out as a political soundbite. If you heard the president when he was trying to get the law passed, you heard it all the time. If you like the coverage you have, you can keep it. And that's really how grandfathered started. Certain plans elected to be grandfathered for one reason or another. There are pros and cons about being grandfathered. The pro is you don't have to comply with all of the law's requirements. The con is you're really kind of limited from a plan design standpoint to what changes you can make. And so I really just want to kind of touch on these changes that we can look at that may cause you to lose your grandfather status. I know myself, I field questions every day. We have a lot of grandfather groups, and we're always, it's just a natural reaction. You get to renewal, you may have a rate increase. You're trying to figure out how to absorb that rate increase, and the natural reaction is to kind of get in your plan and tinker with it. Well, if you're grandfathered, you're kind of handcuffed in a certain way. So the regs give us 5 things that you cannot do. If you do these things, you will lose your grandfather status. The first is elimination of benefits. That's pretty clear. Any increase in percentage cost sharing is the second. An example of that would be raising coinsurance from 20% to 25%. The third one is an increase in fixed amount cost sharing. An example of that would be a deductible. This is a tricky rule to me. It's 15% plus medical inflation. And I don't know if a lot of people really appreciate how much medical inflation is. As everyone knows, medical care continues to become more and more expensive, and it does that at a faster pace than other services in America. And so medical inflation is a big deal. Just as an example, the other day I ran a calculation for a customer. They've never taken their increase yet. They wanted to raise their deductible. They wanted to stay grandfathered. But the medical inflation alone represented 9.6%. So they were able to take almost a 25% increase in their deductible and still remain grandfathered. So just something to keep your eye on if you grandfather and wanting to make some changes. The fourth one, decrease in employer contribution. So that's what you pay as an employer. That's your portion of the premium that you pay. You can't reduce that contribution amount by more than 5 percentage points. Unfortunately, there's no medical inflation built into that. It's a straight 5, and it's on a per-tier basis. The last one is what I would kind of, in my mind, think of as one-way streets, and they're really changes that you can't make, and they're really dictated on whether you had annual limits in place at the time the law was passed. The last two things I have here are disclosure requirements and record-keeping requirements. These are really in my mind, the two most important things. Disclosure requirements. You have to, every time you issue any kind of summary of benefits to your participants, you have to have a notice on there that basically says this plan is believed to be grandfathered, and you have to have contact information for questions or complaints. There's a model notice. A lot of people are using the model notice, so nothing to recreate there. The last one is record keeping. You've got to, any good plan is going to document the changes it makes to its plan, but if you're grandfathered, you're really under the gun. You've got to be able to document any changes that you've made since the law was passed to your plan. And this is why it's so important when the auditors are coming in. This is what they're looking for. They're wanting to see whether a plan either accidentally or intentionally has made a change to the plan and continues to operate under the guise of being grandfathered. You know, we get the question a lot, can I remain grandfathered forever? Well, yes, under the law you can, but the government does not want you to remain grandfathered, one. And two, like I mentioned earlier, you know, when you're dealing with increased cost and you're trying to kind of, you know, make your plan financially viable and make your participants accountable for their health, you really don't have a lot of wiggle room when you're grandfathered. So just a little bit on that. I mentioned grandfathered. I'm on the next slide now. If I have a GF next to something, that means that if you are a grandfather plan, you do not have to comply with that particular provision. And here are the other existing provisions: dependent coverage, prohibition on lifetime limits, restriction on annual limits. You can have an annual today, but it has to be at least $2 million. Pre-existing for children, that's children under 19. Patient protections are really three things collectively. It's OBGYN care. Women have a right to seek that care without a prior authorization or a referral from their primary care provider. The other one is provider choice. If your plan forces you to choose a primary care provider, you, as the participant, have the right to make that choice, and the same on behalf of your children. And then the third one is ER services, emergency room services, which basically say if you're in a true emergency and your injury is a true emergency, you go to the hospital. That hospital has to pay, or the plan has to pay network benefits regardless of whether that hospital is in the network or not. And that makes sense. I mean, you cut your arm off at home, you get in the car and you drive to the closest hospital. You don't get online and look up the network directory. So the other two in internal and external claims review, ERISA has always had an appeals process that plans have had to deal with, and there are certain requirements attached to that. This is kind of really bulked it up, in my opinion. It's really protective of the participant. Now participants have a right to submit testimony, even have a right to obtain documents from you as the plan sponsor. And if they're unhappy with the carrier's decision or with your decision, they have a right to actually request an external review where an independent review organization will actually make the final call on the appeal. The last thing I have here is medical loss ratio rebates. MLR is basically an attempt for carriers to run lean from an administrative standpoint and lower health care costs. So an MLR is a charge on the carrier that basically says, depending on your group size, either 80 cents or 85 cents of every dollar they take in premiums has to be spent on claims. Carriers that do not meet their MLR standards had to issue rebate checks to their customers. So we saw this for the first time in August, last August of 12. We're going to see it again this August, and we'll see it every August after that. It is carrier specific, so what that means is certain carriers will meet their MLR, certain carriers do not. this sounded like a good thing. It sounded like you were getting free money back, but at least in last August when this came down, there were a lot of questions on employers that did receive rebates. You know, what do I do with the money? What can I do with the money? And it really depended on your contribution arrangement. Any portion of the premium that's paid by the employee is technically a plan asset under ERISA. And what that means is you can't go buy a boat with it as an employer. You have to do certain things with it and either reduce cost, cut checks to your participants, or enhance benefits. And so you could see what kind of mess that was. It's, you know, for those that wanted to cut checks, I mean, do you locate former participants that are no longer your employees? If the premiums were paid under a cafeteria plan, there could be personal tax implications, things like that. So hopefully between now and this August, we may get a little more guidance from the government on how to deal with that. These are still some existing requirements, and I've got a little more in-depth on them just because they've been recently passed in the last year. You know, preventive care is basically a provision that says there's a list of services that you can receive as a participant, and as long as they're rendered by our network provider, there's no cost sharing. In August of last year, this was expanded to cover a lot more women's services. You've probably seen this in the news a lot. One of the services that is covered is FDA-approved contraceptives. So a lot of employers, based on their own personal religious beliefs, did not feel like they needed to comply with this. There is a religious exemption. It's been recently expanded, but still, if you're a for-profit employer, you're stuck with this provision if you're not grandfathered. Again, it must be delivered by a network provider, and this is one of the cases that we were talking about. You probably saw it in the news. Hobby Lobby is a big national retailer, and they sued the government in federal court, arguing that they didn't have to comply with this, but the court ruled in favor of the government. I meant to tell you this up front. The way I have this presentation tailored is I'm walking through everything in chronological order. So in my mind, the way I look at the requirements themselves under the law is some are what I would call mandated benefits, and we just looked at one, preventive services. Some are what I would call administrative requirements, and this is an example of an administrative requirement. It's a new disclosure that you have to provide. It's called the Summary of Benefits and Coverage. I'm sure a lot of you are familiar with it, have dealt with it so far, depending on your plan year. But let's take a look at who's responsible for providing it and what exactly it is. If you're fully insured, you and your carrier have a joint responsibility provided. If you're self-insured, you're technically on the hook solely as the plan administrator. That's not to say you can't contract with the TPA to provide it for you. From a compliance standpoint, though, you want to make sure that your administrative services contract has some express language addressing this requirement. The document itself is really two documents. It's a summary, which is an 8-page back and front model document. I kind of call it a mini summary plan description. A summary plan description is an ERISA term. That's the 90-page document or so that you give to your participants. This is a very condensed version of that. It also comes with a glossary that gives plain English language definitions for things that you would think of, like deductibles and cost sharing and premiums and things like that. There is a culturally and linguistically appropriate standard, and what that means is if you live in a county, or say live, if your plan's in a county and that county has at least 10% of the population speaks the same non-English language, then you actually have to put a notice on all your all your summary documentation, basically alerting your participants, for example, if you need this in Spanish, then please call this number, and then moving forward, all notices would be in that non-English language. Another little wrinkle about it that's something different from ERISA is this notion of participant and beneficiaries. Under ERISA, you send any documents to the employees and you're good, you're done. This is a little different. If you or the carrier is aware of another address for a beneficiary, then technically a separate summary has to go to that beneficiary. And you see that a lot. That's becoming more and more commonplace now, especially with children staying on their parents' plans longer. They may be in college, and you may be aware of a college address or a separate address. There are fines involved, just like with anything else, and they've got some pretty good teeth to them. It's $1,000 per each covered individual per each failure. So again, the carriers, in my opinion, are doing a pretty good job of providing this, but That's not to say that you can just hand it over and not have any risk as a plan sponsor. We always let's talk about when it has to be provided. So at your renewal, first day of first open enrollment period, if you don't have an open enrollment period, you still have to provide it no later than 30 days prior to the first day of the plan year. And then you may have seen it on the previous screen, there's this notion of advance notice. So what this means is if you make a change to your plan and that results in a change to your summary, you've got to give your participants 60 days advance notice before that change can become effective. The government got it right this time. This only applies to mid-year off renewal changes. So if you're making changes at renewal, no advance notice is needed. Here's some other instances of when it needs to be required. New hires, it needs to be part of their written materials. Special enrollees, that's a HIPAA term. That basically means if you get married, your spouse has a right to come on outside of open enrollment. Another example would be the birth of a child. For those folks, no later than 90 days from enrollment. And then here's the tricky one to me, the participant request. And this is where you have to watch out, even if your carrier is handling it for you. One of your employees comes to the HR department, asks for the summary. It's got a really short lease, 7 days. So just be aware of that. We get the question a lot about whether all of this can be distributed electronically. The answer is yes, but there are hoops to jump through. There are Department of Labor regulations that address electronic distribution. And really the things you have to watch out for is when you deliver it electronically, you have to make your participants aware that they are eligible to receive a hard copy free of charge if they wish. And then if you have certain segments of your workforce that don't routinely access a computer in their daily work functions, you may want to make sure that those folks give a hard copy. We're seeing a lot of employers, especially ones that utilize an intranet, roll out not only this document but other disclosure requirements on an electronic platform. I've mentioned mandated benefits. I've mentioned administrative requirements. This is an example of what I would call a financial requirement. This is a fee. It's the first of 3 fees that we'll talk about today. It's called the Patient-Centered Outcomes Research Fee. Basically, the money's going to fund clinical research. It's not too big of a fee, $1 per covered life. That is covered life. That's not employee. That's per participant, per belly button, whatever you want to call it. It goes up to $2. And then it can be adjusted for inflation. It's only supposed to last for 7 years. That's the way it's written on the books today. Let's look at who pays it and when. If you're fully insured, there's nothing for you to do. So that's the good news. The bad news is, just like all the other fees, there's no prohibition under the law from the carrier passing the fee on to you. So that's why we talk about fees with our customers and with folks that we meet with, is because we want them to know up front that that's coming down and that's going to be added on their existing premium. If you're self-funded, you actually have to pay and report the fee yourself. So the government loves to tell us how to add, so there are prescribed formulas for determining covered lives. You can use your 5500, you can use a snapshot, or you can do a manual count. The form, how you report it is actually on an IRS Form 720, which is technically a quarterly excise tax form. Nevertheless, the government has instructed us to use that form. You pay the fee at the same time every year, regardless of when your plan year is. So for October, November, December, and calendar year plans, you're going to pay the fee for the first time by the end of July. Again, if you're fully insured, there's nothing for you to do except take the heartburn of that increased premium. But you can really, when we look at the other 2 fees, you can really see what kind of financial impact they can have on your plan depending on its size. W-2 reporting, this is another, obviously, an administrative requirement. Basically, there's some transition relief here right now. You may be looking at the slide and wondering why we're talking about it, because W-2s were just issued a couple of months ago. But I'll tell you why in just a second. Let's first talk about whether you're subject to this or not. If you filed or issued more than 250 W-2s, however you want to call it, in the preceding calendar year, you're on the hook to report. What you report is the total cost of coverage. So that's what you pay as an employer and what the employee pays. So you can see where the dilemma comes in. Some of our customers were prepared for it last year and had their numbers in order. Some were not. And so if you were not, you actually had to go back. You had some homework to do. You had to go back and track the total cost of coverage throughout the year. Your part's easy as an employer. You know what you pay. The tricky part is if you have different tiers under your plan, meaning if you have employee only, employee plus spouse, family, they had different premiums. Your employees paid different premiums for those different tiers. And so that way, you didn't have necessarily a fixed number across the board. To make matters worse, you could have had people coming on the plan mid-year, new hires. You could have had people with the special enrollment right switching tiers mid-year. So I'm bringing this up because if you are subject to it and you were kind of caught off guard with it last year, you may want to put something in place tracking it this year to where when you get to the end of December this year, you got your house in order. Flexible spending accounts, these are 3 other 13 requirements on this page. Excuse me, that's the next page. This is a flexible spending account. For those of you that sponsor them, they've never had a monetary cap before. Now they do. It's $2,500 a year. There's some rumblings on D.C. right now with some Republicans trying to get rid of this, what we call the use it or lose it rule. And, basically, what this is you used to couldn't carry your balance over. So, I guess the motivation now is in light of the cap, you should be able to carry your balance. I don't know if it's going to have any traction or not. We'll see. So just a little bit on that. Here's the slide I accidentally referenced. These are 3 tax issues for 13. Increase in payroll Medicare tax. For your highly compensated folks, $200,000 for single. If they make over that amount over to $200,000 actually has an additional withholding on it, 0.9%. And like I said, that's just on the amount over the threshold. This is something different than the fiscal cliff withholding that you may have seen recently. This is something that's been on the books for a while. The other 2, won't go into them too much. Healthcare expense deduction. If you had non-covered services that represented enough of your income, you could take a withholding if they represented 7.5%. The government's made that a little harder to do now. It's got to represent 10%. And then for those of you that sponsor a retiree prescription drug program, you used to be able to take a deduction on the subsidy itself, and that's gone away, unfortunately. So that's a little bit on the existing requirements. So let's switch gears now. And I've got to apologize. I'm so used to speaking, and I mentioned payroll vendors, and I mentioned some competitors. So I'm sure Chris is not happy with me right now when we were talking about W-2 reporting. But obviously, alliances, got their ducks in a row, no doubt about it. So let's switch gears and kind of talk about future requirements. This is one that just really hit the books. I've been working on this today, actually. This is the notion of an exchange notice. So we mentioned about the law being so broad and affecting everything. Well, this actually revised the Fair Labor Standards Act, which is an existing federal law. So if you're an employer and you're subject to the FLSA, you've got to kick out a new notice to your employees. And this is regardless of whether you sponsor a group health plan, regardless of whether you're subject to the employer mandate. This is a notice that's got to go out to all employees, full-time, part-time. It was supposed to be effective March 1st of 13. We knew that was going to be delayed because the government kept giving the states more time to declare their intent to run their exchanges. And kind of inconspicuously in January 24th of this year, the government finally came out and extended the deadline. Even at that time, they basically said late summer, early fall. That's all they really gave us. Well, on May 8th, the 8th of this month, we've got some technical guidance from the Department of Labor and some model notices. So the new deadline is October 1st. So it seems like it may be a little far away, but it's not. There are 2 types of notices, one for employers that offer coverage, one that don't offer coverage. And what the notice says is basically, here's this idea of an exchange. The government's calling them marketplaces now. They don't like the word exchange anymore. Lets the employee know that they may be eligible for a subsidy depending on their income, and then kind of lays out the consequences of dropping your employer-sponsored coverage. Again, we just got our hands on these a couple of weeks ago, and so, like I said, if this is something that you need to keep on your desk and have your radar on for sure. We're going to kind of dive into, I just referenced the employer mandate, and so we're going to kind of dive in a little bit on this. This is always a hot topic among employers, and granted, it's understandable. So let's just walk through it. I mean, the way the mandate works is it's something different than the individual mandate. It's on employers. It's not what was at issue during the Supreme Court decision. And so the most important thing to remember is it only applies to large employers. So if you're a small employer, you get to dodge this bullet. The tricky part is defining large is not as easy as it sounds. So there are two possible ways to pay the penalty, or excuse me, there are two different penalties, two kind of roads you can go down to pay the penalty. So let's kind of walk through this slide and bear with me because the way I've got this set up is I build off of the quoted words and phrases. So it's large employers, 50 or more full-time equivalents that fail to offer minimum essential coverage to substantially all of its full-time employees, those working 30 hours per week, and their dependents, will be subject to a $2,000 per employee penalty if any full-time employee goes to an exchange, qualifies for a subsidy, and enrolls in an individual product. So this is an example of what we call the big penalty or the sledgehammer penalty, and I'll show you an example of how it's calculated in just a second. But let's kind of walk through it a little bit. Who's the large employer? Like I said, it sounds easy. It's a look back. So you're looking back to the preceding calendar year, regardless of whether you're a calendar year plan or not, and you're looking to see whether you have 50 or more full-timers on business days in that year. There is some transition relief for this year alone, which basically says you can use any 6-month period in 13 as opposed to the whole calendar year to determine your status for 14. But be careful. Full-time is defined as 30 or more hours a week. That's a real low threshold. Most employers have not historically defined full-time in that manner. Another thing to keep your eye on is part-time employees represent full-time equivalents. So your part-timers, you have to look at the hours they work and arrive at full-time equivalents and add those on top of your full-time employees when you're determining whether you're over 50 or not. Another hot topic that we're seeing with a lot of our customers is this notion of aggregation rules, common ownership, control groups. This is an internal revenue code provision that's always been the law. It's not anything new to healthcare reform, but if you have common ownership in multiple business entities, there are chances that in certain circumstances all of the employees could be considered to be employed by a single employer. So, for example, if you had two employees, one person owns 100%, two entities. Let's just say one's a corporation, one's a partnership. One person owns 100%. Each one has 30 employees. Well, on paper, it looks like both are under 50. But in that example, you'd be deemed to have 60 employees total, and you'd be deemed to be a large employer. So there's a seasonal employee exception, which basically says if you're over 50 solely as a result of your seasonals, you can kind of back out of it as long as you were over 50 for no more than 120 days in that year. We'll talk a little bit more about seasonal employees in just a second when we get there. So now we've kind of jumped in. That's the threshold question, whether you're subject to the penalty or not, whether you have to pay or play, as sometimes you make here at reference. Now we're going to kind of dive in under the assumption that you are a large employer. Let's jump through the hoops that we have to get to kind of get to the place we need to be where we don't have to pay a penalty. Offer coverage. You got to open it up once a year is what this says. So let's say you have an open enrollment, someone, you offer them coverage and they turn it down. Well, the next year you still have to give that person a right to come on the coverage again. I mentioned earlier about plans not having open enrollments. Under ERISA, you don't have to have an open enrollment period, but now the way I read this, in my opinion, is you got to at least open it up once a year if you're a large employer. We talked about, having to offer something. Well, what are we offering? It's minimum essential coverage. So we don't have regulations on this yet. The good news is, unless the government takes a change of stance, which they may, right now it's really any employer-sponsored coverage that's sold in your state's small or large group market. So it can really be, the spectrum of products is pretty great. So we're hopeful that the government's not going to really change that too much, but that's something that I'm kind of monitoring on my end. Substantially all. This basically says, I think this is really in the law to not be punitive for employers. Let's say that you're an employer and you're going to do everything you have to do to make sure you don't pay penalties, but there's one employee out there that you may have considered an independent contractor and not an employee, or that you may have thought was part-time and they really weren't. This is really to get you out of that big penalty, that sledgehammer penalty. So what this says is, as long as you offer coverage to at least 95% of your full-time employees, then you're out of the woods on that sledgehammer penalty, that big penalty. You still may be on the hook for the small penalty, and we'll talk about that in a second, but that's what this is here for. We're actually seeing employers use this as a planning tool, quite frankly, especially when you start talking about affordability, and we'll get there in a second, but when you're making sure your coverage is affordable for everyone, it may be in an employer's best interest to kind of pay the small penalty as opposed to increasing wages to make it affordable for less than 5% of their workforce. So just something to kind of play in your ear a little bit. I mentioned counting, determining whether you're large or not is a tricky issue. This is another tricky issue. It's who are my employees, It sounds easy. Remember, we looked at part-time employees on that first question, whether we're subject to the law or not. Now we can kind of put our part-timers on the shelf. We don't have to worry about part-timers. We don't have to offer part-timers coverage. Part-timers will not trigger a penalty for you. But again, remember, part-time is anyone under 30, so it's still that same low threshold. Another wrinkle is it's hours of service, so that's a larger universe than hours paid, or paid hours. This includes paid time off, military duty, things like that. You can use 130 hours of service per month as opposed to the per week when determining whether someone's full-time or not. I understand that 30 times 4 is 120 and not 130, but 130 is the number that the government's given us. Common law definition of employee. This is what we're seeing a lot right now. I mentioned independent contractor earlier. Well, the common law definition of employees is if you can tell someone what to do and even have the power to tell them how to do it, even if you don't exercise that power, that's your employee. So right now there's a big breakdown on employers about using independent contractors when really they're not. And I see people all the time, and they come up to me and they'll say, well, he's an independent contractor, and I say, well, why? And they say, well, I pay him on a 1099. Well, that's great, but it's not conclusive. You actually have to look at the relationship there. If you're treating an quote-unquote independent contractor exactly like you are a W-2 employee, and the only difference is the form you pay them on, then you may want to look at that a little closer. Another thing that makes this whole mandate difficult is, when we looked at the initial question of whether we're large or not, we had that fixed time. We had that preceding calendar year, that nice, neat, fixed snapshot of when to start and when to end. This one's a little different. When you're determining who's full-time, it's based on a month-to-month ongoing basis. So you could technically have someone that's full-time for 1 month, not full-time the next month, and then full-time the next month. And you as an employer are not going to know whether they're full-time until the end of the month. And your exposure's already out there. You can't go back in time and offer coverage. So in an attempt to kind of alleviate this on and off scenario, the government has given us safe harbors that we could use for what we call variable hour employees. And so a variable hour employee is someone if it's a new hire, it's someone when you hire them on the day to hire, you don't have a real good, you don't have a reasonable belief that they're going to be full-time or part-time. You just don't know. Your business operations are going to dictate how many hours they work. That's a variable hour employee. A seasonal employee is also a variable hour employee. The government does not define seasonal. Instead, they've told employers to use a reasonable good faith interpretation of the word seasonal. So that's what we're left with. I do think the government, in my opinion at least, it takes a pretty conservative view of what seasonal is. I think it's something more than the lifeguard in the summer or the ski instructor in the winter. But at the same time, I don't think it's you have to have a business justification to dictate whether you have seasonal employees. We just as an example, we have a customer that's a HVAC outfit in Houston, Texas, and so obviously in the summer it gets hot. They hire more employees in the summer. Their existing employees work more in the summer. To me, that's a good argument for seasonal, but contrast that with someone that's a construction company and they do project work. If you hire someone and they're going to work 80 hours a week, but the project's only going to last for 4 months, that's not necessarily going to meet the definition of variable. It may meet it, not to get too much into it, but there is some transition relief for this year that says that that person could be variable for 14, but after that, that goes away. So just kind of a little insight on that a little bit. We reference in there dependents. So who are your dependents? Well, it's not your spouse, oddly enough. So plans do not have to cover spouses. We're seeing this as a planning tool as well. We're seeing, plans, if the spouse is eligible for his or her own employer-sponsored coverage, you can keep them off the plan. You can keep them off the plan outright. More relaxed view, a little softer touch would be charging a surcharge for that spouse if they are in fact eligible for other and sponsored coverage. So it does basically include every form of a child, whether they're adopted, being placed for adoption, stepson, any kind of thing like that. So that's a little bit on dependents. Here's the example I promised. So those are the hoops that you have to jump through to get away from the big penalty. And this is how the big penalty rolls out. Let's just say that employer A has 100 full-time employees. Employer A does not offer coverage to any of its employees, so they're deciding just to pay. The penalty is $2,000 for each full-time employee minus the first 30. So in this example, it's 100 employees. You take the first 30 off the top, which leaves you with 70. 70 times 2,000 equals 140,000. Let's look at the little penalty for a second. Same trigger. It takes one of your employees to go to the exchange, be eligible for a subsidy, and enroll in an individual product. So that's the trigger under both penalties. You're not going to be penalized until that happens. But this penalty, you'll basically be facing a $3,000 per employee penalty if the coverage is either not affordable, and we'll talk about what that is, or does not meet minimum value, and we'll talk about what that is as well. So again, that's how the small penalty breaks down. You see $3,000, it looks like it's worse than $2,000, but in fact it's not, and we'll see that in a second. I mentioned affordable, so this is a big hot topic. I'm sure a lot of you are crunching numbers as we speak. The way the law is written, it basically said what the employee pays for employee-only coverage. It's that first tier coverage, regardless of what tier they're on. What they pay, that amount cannot exceed 9.5% of their household income. As soon as we saw the law, we jumped up and went to the government. We knew employers were not going to be able to know what household income was. So early on, the government told us that employers could use W-2s, line 1 unfortunately, but W-2s to determine affordability. In January, when the proposed rule came out on the employer mandate, the government gave us the other two safe harbors, rate of pay and federal poverty level. And just as a note, a safe harbor is basically, it's a term in the government means if you use it and you comply with the requirements in the safe harbor, you're deemed to be compliant with the law. So that's what a safe harbor is. The W-2 has its pros and cons. If you have your system set up, like Payroll can do, like Alliance can do for you, you can track this on the front end, make sure, and you're aware when someone's getting close to exceeding 9.5% on the front end. The bad thing about the W-2 is unless you have that in place, you're not going to know what the wages are until the end of the year. And let's say you're looking at last year's W-2s, and Andy made, X amount of money, and we performed the affordability analysis, and everything was fine. Well, let's say next year Andy, does the same thing, makes the same amount of money, but he goes on FMLA leave for a while. Let's say he exhausts his 12 weeks, and 6 of the weeks are paid, but 6 are unpaid. He's exhausted all his paid leave throughout that 12 weeks. Well, obviously, the next W-2 for the next year, it's going to have a different number on it. It's going to have a lower number on it. And so there is a little risk there, and like I said, people like Alliance, that's where they can help you. The rate of pay safe harbor is a really clean safe harbor. The only rub with this is you can't reduce your employees' wages, throughout the year. So the way the rate of pay safe harbor works is you're basically looking at a weekly or monthly income and projecting it out over the year. Again, in my opinion, really clean. Like I said, you just have to be sure you're not reducing wages during that time. The FPL, that's an acronym for federal poverty level. That's there. It's basically the 9.5% cannot exceed the current existing FPL rate for a single individual. You know, this has its downfall, in my opinion, a little bit. I'm not saying it won't work for everyone, but, you know, the FPL is a really low number. And so, you know, my advice to you is if you're struggling with the affordability analysis, try all the safe harbors. You know, you may meet affordability on one and not the other. As far as using the safe harbors, you can use them based on different classes of employees, but they have to be bona fide classes. So you can't say, you know, I'm going to use a W-2 for Chris and I'm going to use the rate of pay for Andy. But what you can do is say, well, I'm going to use the rate of pay for my hourly folks and I'm going to use the W-2 for my salary folks. Another thing to keep in mind is you've got to use that same safe harbor for that entire year. You can't switch throughout the year. Here's the notion of minimum value. The employer has to pay 60%, at least 60% of the total allowed costs under the plan. So that's not a contribution rate. It's more of an actuarial value. There are three tests to prove minimum value. There's a minimum value calculator, which the government, HHS, gave us about a month ago. There's a safe harbor checklist, which I'm anxiously awaiting because I feel like it's going to be a little easier to use than the calculator. And then a plan always has the right to retain an actuary and obtain a certification from him or her. So a little bit on minimum value. Again, it kind of ties into minimum essential coverage. HHS has already come out a long time ago and said that over 90% of all major medical plans today would meet this minimum value standard. The 60%, for those of you who are familiar with exchanges, is going to represent the bronze level. They're metallic levels on the exchange, bronze, silver, gold, and platinum. This would be that very low end, that bronze level. So here's an example of the small penalty. So if you jump through those extra two hoops, you're where we call a safe offer, meaning that if you've done all that, you will not pay a penalty, period. So let's say that you missed out on minimum value, or more than likely probably missed out on affordability. 100-man group, same size as the prior example, 20 of your folks it's not affordable for. So that means it's exceeding 9.5% of their income, basically. The penalty there would be 20 times 3,000 equals 60,000. So, you know, that's how that pays out. We talked about, you know, these employees going and triggering the penalty for you. You know, who are these people? You know, you've got to be lawfully present in the United States. You got to have an income level between 100% and 400%. That's a big window. 400% for a family of four today is $92,000 a year. So it's not necessarily just your minimum wage, folks. It could be a lot of your workforce. So, but here's the catch, and this is what I just said on the last slide about not paying a penalty. That person cannot be eligible for minimum essential coverage, and that includes Medicare, Medicaid, really any kind of government coverage. But look at the last part, affordable employer coverage. So basically what that means is if you offer coverage to everyone, make sure it's affordable, make sure it has minimum value, you will never pay a penalty, period. So that's the safe offer. It must be through a public exchange. The reason I have this here is you've probably seen in the news a lot of large employers, a lot of brokerage houses like where I work at are kind of toying with the idea of rolling out private exchanges. But when we're talking about subsidies or we're talking about penalties, we're talking about either state or federally run exchanges. Here's the second fee I promised you. This is called the reinsurance program fee. And I apologize. At this point, I would typically talk about strategy and the pros and cons about playing or paying and you know different kind of options. And we do that a lot, but I've got an hour, so I've got to kind of move forward and jump to some other things. But if you have any questions on that, I'll be more than happy to answer them or attempt to answer them for you. This is a reinsurance fee. Basically, due to another provision under the law, we're expecting huge rate increases on the individual market. In an attempt to stabilize those increases, we all get to act as reinsurance carriers for 3 years at least. Again, same with the fees. If you're fully insured, there's nothing for you to do. If you're self-insured, you've got to report and pay. We don't know the form. The regs don't specify a form like the other fee. I think the way it's going to work is if you're self-insured, you're going to submit your covered lives to HHS towards the end of the year. They're essentially going to send you a bill, and then you'll have a certain amount of time to pay it. Unlike the PCOR fee, this is major medical products only. So the PCOR fee is kind of tricky There can be some plans like a self-funded HRA or something like that that you may pay the fee on. This is just medical. But look at this one. We talked about $1 and $2. Now, $63 per member per year. So it's got some teeth to it, I think. Here's the other fee. This is the big fee. It's permanent. It's not going anywhere. We mentioned the subsidies. We mentioned the government giving people, low-income people, money to purchase insurance products on the exchange. Well, obviously, money doesn't grow on trees. We know where it comes from. It comes from us. And so this is where the fee goes to fund the subsidies. Again, if you're fully insured, nothing for you to do. If you're self-insured, you dodge it all together, which is great. So, but look at this one, $108. This is an estimate, by the way. The $63, we know that's the fixed number. The $1 and the $2 we know is a fixed number. We don't have fixed numbers on this fee yet. It's tied to the carrier's market share in their specific states. But estimates from the Blue Crosses of the world and the Uniteds of the world is it's going to be between $100 and $110 per member per year. So just as an example, I mean, if you have a 100-man group and you're fully insured, you're looking at about $20,000 a year on top of your existing premium just as a result of the 3 fees. I mentioned the other provision that was going to cause individual products to have huge rate increases. Well, this is it. It's basically carriers can no longer discriminate when it comes to rating. Today, carriers can rate for all different reasons, and that makes sense to me at least. But if you're a small non-grandfather group beginning in 2014, your carrier is only going to be able to rate you for coverage category, rating area, age, but the spread's only 3 to 1, and tobacco use, but the spread's only 1.5 to 1. So we've got projections from the major carriers that in the small group market, you're looking at upwards of 25% rate increases as a result of this provision. Really important provision in my mind. Here's some, I'm kind of running up against the clock. We knew we would. This is the notion of guaranteed availability and renewability. So really what this means is carriers cannot refuse to write you. They can still rate you, but as long as you pay your bills and you don't lie on your application, they have to write you and renew you. Here's some plan design changes. Like I said, we mentioned mandated benefits. We mentioned financial requirements. We mentioned administrative requirements. This kind of goes along the line of the mandated benefits. They're kind of what I would call plan design changes. We mentioned pre-X being pulled for kids back in 2010. Well, it's going away for everyone in 2014. We mentioned annual limits being restricted to $2 million today. Well, they go away altogether in 2014. Probationary periods. Some people call them waiting periods. The most you can have in 2014 is 90 days. So that's 90 days exact. That's not first in the month following 90. Essential health benefits, it's really a set of 10 categories, and HHS has basically punted it to the states, and each state gets to dictate what the actual benefits will be. They'll use benchmark plans, and a benchmark plan is really the most sold product in your state. So that's kind of that's what the benefits are going to mirror that plan. Deductible and out-of-pocket caps. Deductible caps, only if you're small and not grandfathered does this apply to you, but if it does, the most you can have is $2,000 for single and $4,000 for anything except single. Out-of-pocket's a little different. It applies to all groups regardless of size unless you're grandfathered. And those limits are $6,250 and $12,500. I say limits. They're tied to HDHP limits, and the numbers you see on the screen are current 13 limits. So they are going to tick up a little bit between now and 14, but that's an estimate of where they'll kind of land in 14. Here are just some other requirements, just briefly. Increase in preventive wellness incentives. Today, you can sponsor a wellness program, and you can incentivize your employees for participating in it, and you can either, however you want to call it, reward them or punish them, but the spread can only be 20% of the premium or the contribution. That's going up to 30%, and if it's tied to tobacco use, it's going up to 50% in 14. To me, this is a huge win for employers. I really do sing the praises of wellness programs. I really think as an employer, it's your last arrow in your quiver for you to have control over the cost of your plan unilaterally. We're seeing more and more employers use wellness programs, so a little bit on that. Coverage for clinical trials, all we have is the statute, no regs. Basically, you can't discriminate against your participant if they want to go to a clinical trial. You may even have to pay some of their routine costs. The next one I have here is a pretty hot topic right now. It's what I would call 105H. That's the section in the Internal Revenue Code. It basically says you can't discriminate in favor of your highly compensated individuals. This has always been a law for self-funding groups, but healthcare reform has pushed this down into the non-grandfathered, fully insured world. It was supposed to be effective in 2010, and that's a big reason why a lot of small groups remain grandfathered, because they had a carve-out group. Implementation's been delayed. The government's been gracious enough to tell us they're not going to enforce it until they give us the rules, which is only fair. I'm being facetious. We think the regs are going to come out in 1/1/14. That's just my opinion. Like I said, there are regs on the book today that basically define highly compensated individual, and there's an eligibility test and a benefits test that you have to push it through to make sure that you're not running afoul of the statute. But again, that only applies to self-insured groups today. Auto enrollment, this is one that implementation has been delayed on as well. It was supposed to be effective in 2014, and the government's already come out and said that it's not going to be ready for then. It's only going to apply to folks with more than 200 employees. Just a little bit, like I said, you got additional reporting requirements coming down the pike in 15, especially if you're a large employer subject to the mandate. There's going to be additional reporting to the IRS for you. There's going to be additional disclosures to your participants. There's also going to be some quality of care and transparency and coverage reporting requirements. I know I have health insurance coverage up here twice, but if you notice, there are two section numbers. That's just the titles that the government gave us, but those are two things tied to the IRS and to the employer mandate. And then finally, the Cadillac tax. We won't talk about it really at all. It's a 2018 provision. It's targeted at attacking maybe these what we call concierge or executive level group health plans. But based on the numbers today, you may see a lot of plans fall within these thresholds come 18. It's just too soon to see. A lot of people are going to make plan design changes due to the mandate, so we kind of want the dust to settle a little bit before we kind of dig into the Cadillac tax. You know, I mentioned earlier about some people being unhappy with the law. You know, the time to complain is over, in my opinion. I mean, you got to be proactive about this thing. You got to be engaged. You know, if you're subject to the employer mandate, you need to start thinking about decisions right now. You need to start, you know, at least trying to gauge your affordability analysis. If you're going to use some of these variable hour safe harbors that I talked about, a lot of those, you know, that first period, that measurement period, it really needs to start running in 13. So, you know, there's not, you know, you're not going to be able to flip a switch. It's something that you need to get your hands around right now. It's no longer an HR issue. It's a business operation issue. And so, you know, I strongly encourage you to you know, to be involved with other people. You know, I know you guys are Alliance customers, and I strongly encourage that. Like I said, you may have to work with the CPA. You know, you have a control group. You may want to refer to a tax attorney about tax issues, about paying or playing. You know, obviously our company, we have brokers, you know, educated brokers to talk strategy and implementation with you. So with that being said, I'm going to pass it back over to Chris, and I hope I haven't taken too much time, Chris.
No, you're doing great, Andy. Right now what we're looking at on the screen today, this is a live version of AllPay. So one of the first areas, we're in the Affordable Care Act Management Tool area of AllPay for clients. This is located in the company setup area. The first thing that you'll notice is the W-2 reporting area. So when Andy was talking about larger employers that have produced over 250 W-2s, this is where you can see where you're at in that world. Your totals are going to be displayed right in this top area, and we're going to run those totals across your EIN sets for our clients that have multiple EINs. And for our clients last year that had to report Box 12DD, what you experienced was we knew that you were over 250. We contacted you. For the folks that weren't using the benefits administration tools built into AllPay, we reached out to you. We collected the premium amount in total that needs to be reported, and we didn't send out any W-2s until we had that information, because we wanted to assure you and make sure that everybody knew that things were going to be compliant moving forward. When Andy was talking today, and he was talking specifically in a few of those slides about how to decide if you have enough full-time equivalent employees, the magic number seems to be that 30-hour average or that 130 hours worked per month. So we built into the all-pay system for everybody. We have all of your earnings codes that are populated within your company right in this section right here. And if you haven't, just go ahead and take a look. And to make these earning codes track back to track your earned hours, all you need to do is check the box next to the earning code. And remember, when you're going in here and you're making your elections, you need to select earning codes for employee compensation. So this would be earnings for things such as your employee's vacation time. If they've accrued PTO, that must be included with the total calculation to come up with their average hours worked. Also, if you're paying your employees for things like jury duty and you have an earnings code associated to that, you're going to want to come back in here and check the box for that, because those are hours that you're going to be required to track and manage. So if you're using all pay today, your earning codes are already here. You just come back in, you select the checkbox and click Save. Everything that I'm talking about, I'm going to show you why it's important that we can do this for you today. And we are the only company that offers a system that can do this. The next thing that you need to track and manage, as Andy was talking about, the ability to track and manage the 9.5% for your low-cost plan that you need to offer to your employees if you're participating in the play world. There's two options available to clients within AllPay. For clients in which you're doing full benefits administration, and just a little background on that, you can have your entire benefits program built into AllPay, in which all the enrollment and open enrollment functionality can be managed online for your employees via their MyPay self-service portal, so that's a completely paperless process. And all the deduction codes are synced directly back to the benefits program, which we can extend up to most carriers to completely eliminate any manual transmission of data between your AllPay system and your carrier. It happens as an automatic transaction in the middle of the night. So for our clients that are using our benefits administration tool, all you need to do, because we're going to set your benefit plans up for you, is to come in the back and you're going to select the benefit plans that you need to track and manage. You might have 2 health plans that you want to track and manage. For our clients that aren't using our benefits administration suite, but you are using payroll deduction codes to track and manage your employees' deductions, healthcare deductions, we built in a resource so you can do that too, because we don't think everybody has to be forced to use a benefits administration tool just because of ACA. So if you're just using payroll deductions to do it, what you're going to want to do is reach out to your broker, talk to your broker, and you're going to come back in this medical deduction area. You're going to come here, you're going to click Add New. If you need any help doing this, just reach out to your customer service rep, and they're going to walk you through the process. So we want to work on our deduction code. We're going to select what our deduction is. If it's medical, we're going to go ahead and just select a medical plan. And what we want to do is we're going to define what the cost associated with this is. So I click this little calculator. So if it's an employee-only plan in which the premium the full amount, say it's $1,000, goes towards the employee, that's simple. 100% of the payroll deduction needs to be attributed to the employee. That's easy. If it's an employee plus spouse, employee plus family, in which the benefit cost could be perhaps $2,000 for the employee, your broker is going to let you know that of a plan like that, only $1,000 is attributed to the employee. So what we've done here is we're syncing up the deduction back to your payroll the payroll deduction, and you're going to need this to make sure, if you're offering a low-cost plan, you're going to need this to manage and make sure that your 9.5%, your low-cost plan, 9.5% of that premium can't exceed 9.5% of the employee's total wages. So you set everything up. What we've done here is we're tying all of the information you are routinely collecting with each payroll that you process and all the benefits that you're managing into the AllPay system. And one of the other tools here is the Employee Threshold Email Notification resource. What this is if you are concerned about and you want to be alerted to when your employees are averaging over 30 hours worked per week, or you want to look to see when your employees are going to go over this mark, we've created a resource in the back of AllPay that can be set up so that an email alert can go out to your managers and supervisors of your locations and your business and your HR department. So each payroll that would run, the system's going to go through and run an average report, and it's going to look at whatever your threshold is. In this example here where the red dot is, I'm saying the average weekly hours threshold is 25. So what's going to happen is if I'm a manager and one of my employees starts to average over 25 hours, and you set the date range here, And this date range should look similar to what your look-back period is going to be. And if you need to learn more about your look-back period, please speak with your broker, or you can reach out to us and we can get you in touch with some of the compliance experts that have spoken in our webinar series. So here I'm setting it as 25 hours. So if I'm a manager, I'm going to get an email notification. It's going to list all of my team members that are averaging over what the threshold is. For a lot of businesses, this is just a nice heads-up notification so you know which employees are approaching the threshold. Some businesses have discussed the opportunity to try to schedule employees to below the 30-hour average. So this is a resource that can help you stay informed and help your team make better business decisions. The reason that you want to track and manage all this information ultimately comes down because you're going to want to have the ability to quickly and dynamically run your ACA look-back report. For our clients that have been working with Alliance for years, you're in a fantastic position today if you're trying to figure out what your look-back period is going to be, what the overall cost of offering a low-cost plan could be, and you're trying to figure out perhaps how many full-time equivalent employees you have. Is the rule going to affect you if you're right on the verge? Specifically for our clients that have variable hour employees and seasonal employees, the look-back period, it's already in your all-pay system. All you need to do is set the charts that I just showed you here, and again, just reach out to your CSR. They're going to walk you through the process. You come back in, and you can start to run what-if scenarios, but with your look-back period, and your broker will help you figure this out. You set the range for what your look-back period is. You select Run. The system's going to pull your data automatically, and it's going to produce the following report. So the report that you see in front of you, what it is, it's going to break down the hours. If you think about some of the things that Andy was speaking about today, we're going to total out the hours worked for the employee. It's going to break down their average hours for the look-back period you're looking at, and you're going to see a variance for all the people that are averaging over 30 hours. So this person, Alonzo Thomas, at the top of the screen here, he's 2 hours over the average, so he would be falling into a full-time equivalent employee. Then the next section, in the aqua-colored section here, we have wages and deduction. We're using real earnings here, real gross wages. We're putting an instant calculation on it to show you what 9.5% of your real gross wages is, and we're going to show you what the actual employee earned medical deduction is going to be. And all this information is tied back to those check boxes that we were just looking at in the ACA Management Tool Setup section. And lastly, we have the benefit data. So all your low-cost plans and everything that's tied in that you have managed in AllPay, it's going to show you what percentage they are of the low-cost plan, if you're in compliance, and all that information. So this is a resource that as a business owner and an AllPay user, you're going to look to this report routinely to track and manage the overall status of your employees and to make sure that everything is compliant. A lot of brokers that you work with are going to appreciate that you have this type of resource because it's going to help them better prepare you as we all move towards 2014. And in today's session, something I didn't plan on showing but I thought I would bring up, Andy touched on some new materials today, specifically the ability to communicate electronically with your employees, because some of you are going to now be mandated to distribute the summary of benefit coverage to your employees. And Andy also talked about the ability to distribute the exchange notice in October to your employees. AllPay has some tremendous communication tools automatically built into it. If some of you, our clients, aren't aware, you do have the ability to instantly go ahead and use the email template area to create email templates that you can distribute out to all of your employees in the one push of the button. Here's the state exchange notice. I could send this as an email using the mass communication tool over here, or a better use of this technology and the ability and leveraging AllPay to not only track and manage your employee data but help you remain in compliance as a communication platform is to use the new needs tool associated with the application. So what you can do with your employee benefit summary of coverage and the employee health care exchange, you can use the needs tool to distribute the notice and the summary of coverage, and this notice is going to go out to your employee self-service portal. From within the self-service portal, your employee is going to be allowed to review the documentation. They can download any plan summary documentation that may be included, and you can capture an electronic signature. And all of this is going to be recorded, time and date stamped within the AllPay application, and you can electively decide to allow some of these things to remain for the life of the employee within their system. So as an example, if I needed to send out an employee health care exchange notice in October, I can come back here and create a need. Again, for clients that are new to this, call your CSR. We'll set this up for you. I would set up my number of employees I want to send it to. I set create need. When the employee, at this point, the employee in their email inbox of record, they're going to get a notice of the exchange. And then it's when the employee also logs into their MyPay, this is their employee self-service portal. When they log into the application, there's going to be a copy of the email that was sent out to the employee. There's a red receipt because I've just clicked the red button. And then in the employees to do area, to do new healthcare exchange notice, there's an open item. It's going to be a policy summary. The employee is going to need to submit. And now we're going to go ahead and collect an electronic signature for the employee. And here for the electronic signature, the employee uses their MyPay self-service login as their legal electronic signature. So I'm going to go ahead and do that. So now I've produced a policy, the exchange notice. I've pushed it out to the employee. I've captured an electronic signature. This is legal. I can go ahead. The employee can download a copy of it. I can make it so that this healthcare exchange notice is always available to the employee in their MyPay portal. It can be available in their documents area. And I'm going to have a recording of this back over in the AllPay area because I decided with my healthcare exchange notice I want to keep a copy in the document section, or I could go ahead and keep it in the benefits area. So when I go into MyPay and I look for my sample employee, I just have to pull my sample employee out of my filter up here at the top. Documents. Here it is. I just need to sort it properly. And here's the healthcare exchange notice. I have a record of it that I can go and download and has a valid electronic signature in case I ever need to produce it. So that's some of the communication tools that are available within AllPay that's going to help you remain in compliance as you move forward. And then for clients that haven't been aware of using the full benefits administration tool in AllPay, we take your plan documents, we build them in AllPay, and you can completely take your paper-based benefits administration program. We put it online for you. Complete plan summary information. The employee can change personal information, dependents, and then they can work through signing up for your benefits. And this is really going to be a huge help for our clients that are just now moving into a space in which you're going to be offering a low-cost plan to a larger volume of employees than you're used to. So that is a whirlwind tour of a lot of the tools that are available to all of our existing clients today within AllPay. If you are a client and need more information, please contact our office. And we can arrange a presentation to give you a new tour of the system if you haven't seen all the features that are available. And for our guests on the call, obviously reach out to your account development manager, and we can also create a one-on-one presentation to show you what need be. So we're going to move over to Andy now. Andy, have you had a chance to look over some of our questions?
Yeah, sure. I mean, and just like I said, I mean, I can't emphasize enough how great your tools are. I mean, and just to let y'all know, I mean, the reason that I agree to participate in this call is because we're partners together. I mean, we not only do we recommend Alliance services to our customers, but we as BancorpSouth use Alliance's services as well. So, you know, that's how our relationship has taken place. So there's some great tools, and Chris, I'm excited to know about the exchange notices. That's something that I didn't know, and that sounds great. So, yeah, we've got a lot of great questions, and like I said, I'm cognizant of everyone's time. I think we're about at 20 till 3. You know, if you're okay with it, Chris, without selling anybody short, it may be better just to answer them all and send them all out instead of, you know, staying on a little longer since we're already 15 past.
Yeah, absolutely. What Andy's talking about, we're going to take all the questions gathered today, and we're going to give those over to Andy this afternoon. He's going to prepare a question summary document in which he's going to look through everything, and we're going to send those out next week in an email that should also contain a recording of today's session. Thanks, everybody. Have a great weekend.